Welcome to our podcast, which is part of the Global Change Management Compendium 2022. In this compendium, we will explore different thoughts and frameworks which can guide sustainable development towards a future inside of our planetary boundaries. Of crucial importance are the ideas of planetary health and the Doughnut Economy, operating as the overarching concepts behind our research. Now, let's dive into our next topic to find out how we can actively shape a future worth pursuing and living for. My name is Lukas, and in this episode, I will take you on a journey to learn more about the health factors of the Doughnut Economy. Even though this concept sounds like it's focused on economical factors, we would like to show other aspects which are part of the Doughnut. One of these aspects is health, more explicitly, the human health. This is why I would like to focus on the aspects of the ongoing crises like the climate and the biodiversity crisis, and dive more into their impacts on the human and planetary health. I will give a short introduction into this topic and met with someone from the movement Health for Future, which wants to raise awareness about the problems and what needs to be done about it. But let's go into a more general introduction to the topic first. Rising sea level, rising average temperature, more extreme weather events like floods, droughts, or heat waves. Already these words imply the negative impacts on human bodies. The World Health Organization, WHO, says that climate change is the biggest health threat facing humanity. This is due to the broad range of the climate crisis, as it affects, for example, safe drinking water, sufficient food, or secure shelter. These effects lead to impacts on human health. According to the WHO, it is expected that an additional 250,000 deaths will be caused every year from malnutrition, malaria, diarrhea, and heat stress between 2030 and 2050. This can lead to direct damage costs between $2 and $4 billion per year by 2030. There are big differences between the world's regions and age groups. The study shows that people above 65 or below 1 year were the most affected by record-breaking temperatures of over 40 degrees Celsius in the Pacific Northwest areas of the USA and Canada in 2021. The Human Risk Index, which is made by the German environmental NGO Germanwatch, tries to point out global differences in negative effects of the climate crisis. Altogether, already 475,000 people lost their lives between 2000 and 2019 as a direct result of more than 11,000 extreme weather events. Especially developing countries are hit hardest because they are more vulnerable but have a lower coping capacity. I think it's the best when we listen to experts in the respective topic. Therefore, I reached out to the movement Health for Future. It is a movement committed to an intact climate and ecosystem and our health, because healthy people can only exist on a healthy planet. We will talk a bit more about the movement itself in the next minutes, but first I want to present Marie. She studied medicine and graduated in May. She's active in the chapter of Health for Future in Freiburg. So Marie, what happens in the body in an extreme heat event, and why can this lead to severe damage and even to death?
Usually if our body core temperature rises over about 37 degrees, we regulate it by evaporation, so sweating, and by convection, meaning that the air surrounding us absorbs our body warmth. This mechanism only works if the air surrounding us is actually cooler than our body. And also evaporation can only occur when the humidity is not too high. So in a very humid, warm or hot environment, our usual coping mechanisms just don't work as effectively. So now if our core temperature rises, that leads to more oxygen consumption and a higher metabolic rate, so that we breathe more frequently and our heart rate increases. That's also why heat waves are especially dangerous for people with cardiovascular and respiratory diseases, because they can't compensate as well. If our body's temperature stays high, we can then develop symptoms like confusion, extreme weakness, muscle cramps, vomiting, and in the end, all organs can be affected. If our body temperature reaches about 42 degrees Celsius, many enzymes just stop functioning. And then, obviously, everybody reacts differently to an extreme heat event. It also depends on whether you're already acclimatized Groups that are especially at risk are the elderly, infants, pregnant women, but also people without any health condition, but just working outdoors, so being exposed heavily to the heat, or homeless people.
Thank you, Marie, for this explanation. We can see that with every degree of temperature rise, more and more people will feel direct impacts on their bodies. And with this, I would like to come to the movement Health for Future. So Marie, what is Health for Future and who is involved in the movement?
Health for Future is a movement for everybody committed to an intact climate and ecosystem and our health, basically. So we are nurses, therapists, doctors, students and trainees in the health sector, and also people with transdisciplinary backgrounds who have united behind the science, because already in 2009, the Lancet stated that climate change is the greatest global health threat of the 21st century, and we take this very seriously and try to fight it. So the first local Health for Future group was founded in 2018. Since then, there have been many new groups that cooperate on a local, national, and also international level. On the one hand, we try to educate each other and the public about the effects that the climate crisis, biodiversity loss, and pollution have on our health already today and in the future. For example, the things I told you earlier about extreme heat, I did not learn that at university. I had to do the research myself. Although, for example, in 2003, 70,000 people died in Europe because of extreme heat. So it's really something that should be integrated into our curricula.
Thanks a lot. And what are your demands?
Our demands are to make the treatment of the climate crisis and its consequences for our health a central task for the health sector, and to integrate it into political and social decision-making processes, to take health impact of climate change into account in all climate-related measures, and to make the topic of climate change and health mandatory in the curricula of education, training and further education of all health professionals.
To achieve these demands and play an active role, Health for Future started the so-called Planetary Health Academy in 2020. The health sector and those working in this field play a central role in communicating, preventing and handling the effects of the climate crisis. Health for Future did not just want to wait until the climate crisis and its impact would end up in the education for the healthcare sector, so they just started it themselves. The online academy offers diverse educational formats, mainly for people who work in the health sector. Due to the upcoming changes, the pressure on the health system will increase to handle the negative impacts of the climate crisis. To support the people involved, the Academy offers online courses on all parts of the concept planetary health. This includes environmental sciences, medicine, public health, and social sciences. To sum it all up, the people who listen to this podcast might have heard about Health for Future for the first time and are now excited about the movement and would love to learn more about it. How can people get involved with Health for Future?
To get involved with us, you can visit the website. It's healthforfuture.de. There's all the information you need about the local groups, and there's a list with all the email addresses. You can also just look for us on social media. Most of the local groups have a Facebook or an Instagram page. And then, check out all the information there is. But also, you can just show up and become part of the movement, basically.
Thank you, Marie. With this, we come to the end of this podcast. I hope you found it as interesting as I did. We learned a lot about the negative impacts of the climate crisis, but on the other hand, we have seen that we can do something about it. And if we all stick together, we can still change something. If you want to learn more about Health for Future or want to read up on the topic of planetary health, you can find my sources and some additional information in the show notes. You can as well find more papers and all the recorded sessions on the website of Health for Future and the Planetary Health Academy. Thank you for joining, and I hope that you will have a look at the other contributions from our Global Change Management Compendium. Thank you for listening to this episode. This podcast is part of a bigger contribution from our Master's program. We would like to invite you to listen to the other episodes and have a look at our website to read upon more topics. Further information can be found in the show notes.